question for you. How are you today?
Hi, good afternoon. My name's Chane Arundale. I'm a registered student nurse. Thank you for having me here today.
Yeah, three questions. The first question is, give me an example for a situation where you had to identify and manage a clinical incident or risk. What was your situation and what was your process you went through to address this? And what was the most significant challenge or what was your outcome?
Yes, okay. So my understanding of clinical problem solving involves applying the clinical reasoning cycle to guide your decision making. A situation I can reflect on was while I was on clinical placement as a student registered nurse. I had the task of completing the morning vital signs for my patients. And for one of my patients, I had noticed an abnormal vital sign. The respiratory rate was elevated, and this was inconsistent with their baseline, which then raised concerns for myself for potential clinical deterioration. And it's my responsibility in recognizing these abnormal rates and accurately applying the SIRS policy, as well as to ensure the abnormal findings were accurate and they were communicated to my to my registered nurse, buddy nurse. They were documented and escalated for a timely clinical review by the treating team, and my patient was going to receive appropriate intervention. As a student nurse, my most significant challenge was to confidently and effectively communicate my concerns for my patient through the ISBA handover to the treating team and to initiate the clinical review for my patient. Um, I first documented my findings in EMR, alerted my body RN, and then remained with my patient throughout the situation and monitored for any further clinical changes. After I initiated the ISBA, I clearly outlined the situation and recommendations for a clinical review of my patient. And my initial interventions were to reposition the patient and optimize their breathing and place them on some oxygen. The treating team then responded quite promptly, reviewed the patient, and implemented an ALTIC calling criteria to ensure closer monitoring of my patients. And I realized that through early recognition and escalation, this helped prevent further deterioration of my patient. Thank you.
Thank you. The next question is, describe a time where you had to communicate a safety concern to a patient and family member or carer. What step did you take? What was the outcome?
Yes. Okay. So while I was on clinical placement, I was in the emergency department and I cared for a patient that was receiving palliative care and they were clinically deteriorating and had a not for resuscitation status. And while checking the MAR, the treating team had prescribed multiple medications such as morphine, hydromorphone, and midazolam. And could lead to the increased drowsiness and forgetfulness of my patient. So later in the evening, in the shift, the patient's family had visited, and the patient's family then expressed some distress to myself over the sudden changes of like in personality of the patient and like the responsiveness of the patient. And it was my responsibility to ensure that the patient's autonomy and the wishes are respected, whilst also upholding the addresses of the family's concerns. I needed to escalate this situation appropriately to uphold ethical and legal standards to ensure safe patient centered care. I first informed my buddy registered nurse of my concerns regarding the patient's sedation and the family's emotional response. Together, we escalated this issue to the nurse unit manager and the medical officer, and they organized a family meeting. And during this, the treating team consulted with both the patient and their family. And then this led to the review of the patient's goals of care and formal preparation of the updated NFR documentation. Throughout this process, I maintained respectful and compassionate communication, ensuring that my professional regulations and procedures were followed. Um, the patient's wishes were then upheld and the family felt supported and they were felt well informed of these decisions. The care plan was then adjusted to reflect the patient's goals and the NFR documentation was completed in collaboration with the treating team. This experience reinforced my understanding of the ethical nursing practices and the importance of multidisciplinary communication and the nurse's role in advocating for both patient safety and autonomy. Thank you.
Well done. The next question. How do you New South Wales has core values of collaboration, openness, respect, and empowerment relate to your role as a registered nurse or registered midwife? Provide an example from your clinical practice.
Yes, thank you. That's a good question. So, the core values of collaboration, openness, respect, and empowerment are the New South Wales health values for promoting optimal healthcare and safety for our patients. It aims to foster an environment that encourages healthcare staff to actively work together, which produces environments, improvements for enhancing patient healthcare outcomes through positive workplace interactions. While on placement in a mental health, drug, and alcohol rehabilitation ward, I was involved in the care of my patients undergoing long term recovery. This ward operated with a really strong multidisciplinary approach, and I was invited to participate in regular team meetings focused on patient centered care. My tasks were to contribute meaningfully to these meetings by advocating for my patients' needs and sharing relevant clinical observations. It was important to engage respectively and collaboratively with the team, and this would support the optimal patient outcomes. I demonstrated collaboration by actively participating in these MDT meetings with assistant nurses, enrolled nurses, nurse unit managers, and medical officers, where we were discussing care plans and shared concerns for our patients. I practice openness by communicating my observations honestly and transparently, contributing to the discussions about patient progress and treatment strategies. I showed respect by valuing the diverse perspectives and the expertise of each team member, which also fostered a supportive and inclusive environment. And I felt empowered to advocate for my patient using my own clinical reasoning to suggest adjustments to their care plan that aligned with their recovery goals. My contributions were acknowledged by the team, and the care plan was adjusted to better support the patient's recovery. And this model of care, the collaborative and respectful environment, led to improved patient engagement and progress in their care. This experience reinforced how core values guide ethical, effective, and compassionate nursing practice. Thank you.
Thank you, Jeanette. Thank you for joining this interview.
Thank you so much.